our speakers. Our first speaker to start the Health Literacy Foundations is Linda Peters. She's currently the Community Health Outreach Coordinator for Our Lady of Lourdes. And before working as an outreach coordinator, she worked as a nurse for 35 years. So please give it up for Linda Peters.
I know y'all thought I was just 35. Yeah. And right now it's 37 years because I haven't updated the information. I'm pleased to be here. I want y'all to know that I've been in the seat and I've been on the stage. And I always, if I can glean one little golden nugget, those things that you can keep for a lifetime to treat our people in our community better. So I hope y'all glean a little golden nugget. I'm a storyteller. I like to tell stories, and I'm going to tell you a little story, and it's about my mother-in-law. It's not HIPAA because I'm the caregiver, and I have her permission to talk about her. I won't say her name. But she's part of an amazing program that Lourdes sponsors in the community. It's called PACE. And PACE is like an over-the-top adult daycare. They take care of the patients from head to toe, from the rooter to the tutor, like my mama used to say. They monitor them. It's an amazing program, and she happens to be one of the long-standing patients here in Lafayette since it opened. But one thing about my mother-in-law is she doesn't want to own her own health. And when people don't want to own their own health, they shut down sometimes and they don't hear what we are telling them as a community worker, as a hospital worker. They shut down. So she tells me they have these vaccines, the COVID vaccine, the flu vaccine, and recently they wanted to give her the shingles vaccine. And she calls me and she says to me, should I take this shingle vaccine? So I said, should you? She says, well, I don't know. She said, if you tell me I should take it, then I'm going to take it. So what she wanted me to tell her was whether to take it or not, because she didn't want to own her own health. So what I had to stop and do was to explain to her why they wanted to give her the shingles vaccine. We have to get our people in the community to want to own their own health, but we have to say it in a way that they understand. I recently was at an event, and we had a speaker, and we actually put the event on, and I had someone to come out and speak on sleep apnea and sleep disorders, and it was a physician. I understood about 20% of what he said, and I'm a nurse, and I've been a nurse 37 years, and he was talking to an elderly crowd, and he asked the question, he asked, does anybody have any questions? And nobody raised their hand. And so I started asking questions to make it plain. So we have to realize the way we talk to people. I have something called pretzel. I always say we all have all kind of acronyms. So it's pretzel, okay? Or you can say pretzel, because I love me a pretzel. You have to keep it plain. You have to keep it real. You have to keep it simple. And you have to keep it local. When you are dealing with the community, when you are dealing, I'm going to sit here and I'm going to say, you are some very intelligent people that I'm speaking to right now. Very intelligent. But how many of you know about the medical world, medical technology? How many of you know about the medical acronyms? And so I could sit here and I could say some things to you and I could use these big, extravagant words and sound so smart to myself, and y'all don't understand what I'm saying. And then pride comes in. Boy, pride comes before the fall. Pride comes in with people. So they didn't ask any questions because part of it was pride. I don't want you to think I don't understand, and I don't want you to think I don't understand, and I don't want you to think. I don't care. I'm one of those I don't care. I'm going to ask. So it's not just people with a lower education. It's educated people. So we have to keep it plain. Keep it plain, keep it real Talk like you're talking to your best friend. Keep it plain. Keep it real when explaining. Keep it simple. And once you finish explaining it to them, whatever it is, you have them explain it back to you. Oh, say, what did I just tell you? Tell me, what did I just tell you? Okay, we're going back to my mother-in-law with another story. She's been diabetic for a long time, for a very long time. And she was only taking pills. Well, we all know what diabetes could lead to? Diabetes can lead to renal disease. That's one of the things, okay? It attacks our kidney. Sometimes we say renal disease. Some people don't know what that means. Your kidneys. So they had her, they've been monitoring her. They do tests on her, okay? And they explained to her that we're going to move you to a different medicine to try to help your numbers of your kidney because we don't want you to go into kidney failure. Okay, let me tell you what she understood. This is what she told me. They gave me some medicine. They told me the medicine could mess up my kidneys. And then now I'm going to be on a dialysis machine. And I'm telling you right now, I'm not getting on that machine. I'm not taking, that is what she heard. So what I did, I called the nurse. And I said, tell me what you told my mother-in-law. I said, let me tell you what she told me. Then I explained it to her. I said, you shut down. Because how many of you get some bad news and you shut down? The doctor's still talking, but you shut down. You didn't hear. All she knew was kidney failure. I see people on dialysis. Some of these people leave here every day and go to dialysis for 3 to 4 hours. They gone. I'm not living my life like that. And it's not what they told her. So Pretzel, y'all gonna use it? What is it? Keep it plain, keep it real, keep it simple, and I'm gonna get to local. Okay, local. When working out in the community in Southwest Louisiana, Creole cooking, Cajun cooking, food, pig tails and pig feet and ham hocks and some red beans, okay? That's what people know. We have a family gathering. There's meat in the corn. There's meat in the beans. There's meat in the oven. I'm telling you, there's meat everywhere. There's meat all over that food, okay? Starch party. And it's hard, and some people will not. My mama ate like that. My daddy ate like that. I'm not changing the way I make my beans. It tastes good like that. I'm not asking you to change your beans, but what I'm asking you to do with your beans is keep the meat in the beans, but kind of change your meat that's in your beans. Smoked meat is just the smoke that's in the meat that's making the food taste better. There's smoked turkey, so put some smoked turkey in there. So it's just those simple, real things that we can do to help our people change a little bit. We're not going to get them to change everything. And some people just don't want to change. They don't want to own their health. They're reactive instead of proactive. And like Holly said, they have a Medicaid card, and then they feel they're limited with Medicaid. We need to educate on Medicaid and what Medicaid services have expanded so much. Medicaid has gotten better over the years, but the lack of knowledge, our people perish. That's scripture. That's in the Bible. Our people perish for the lack of knowledge. And it's not just the knowledge of God's word, it's the knowledge, period. Period. I can give you all the statistics in the world and tell you what's going on but to look into somebody's eyes and to see fear, to see pain, to see lonely, to see hurt, and there's nothing that I can do. We are some powerful people. We have the power of connection. Connected here, connected here, connected here, connected there. I don't know it all. I don't want to know it all. I love staying in my lane, but I love connecting people to what they need and to who they need in our community. Keep it plain, keep it real, keep it simple, keep it local. And we have to realize, I don't want to just keep it and talk about Creole and Cajun. We have a lot of Hispanic people and Cuban people. I just recently found out we have a lot of people that are from, oh God, give me the word. Where are they from? Honduras. I didn't know we had a lot of Honduran people. So when we think of local, we have to think about all people in our community. We have to think about the Indian people. We have to think about how they eat. We have to look into those things. We have to own that so that we can help them and communicate, keeping it plain, keeping it real, keeping it simple, and keeping it local. We have to love our people that we're taking care of. Working in the community, I've learned that a nun said something. I'm going to give y'all a golden nugget. Listen, for those of you who think if you don't get it to the masses, she said this. She said, they asked her a question, and she worked in Haiti because the Franciscan nuns, Lourdes has some nuns that are in Haiti doing outreach. And she said the question was posed to her, how do you feel when you're helping these people and there are dead people on the street and the line is long and you look out? And she says, honey, let me tell you. I take care of that one person who's in front of me. I take care of them to the best of my ability for that day. And the rest of it is God's business. So y'all remember that. Y'all take care of that person sitting in front of you. Don't worry about the masses. And I used to be so caught up in numbers in our community. It wasn't successful because we didn't have a lot of numbers. It wasn't successful because we didn't get the numbers, the statistics. No. It's that one person I helped, that one person I connected, that one person I told it to him plain, I told it to him real, simple, and I kept it local. And that's pretty much the easiest way to help with our literacy issue in our community with our people today. We have to be connectors. And I tell you guys, there is amazing power in connection. We have to I'm a Dr. Google. I'll Google something in a minute because I've fixed cars, I've fixed the dishwasher, everything. But Dr. Google can cause you some problems because Dr. Google puts fear into people. It put fear into me when I was facing a medical challenge. So we have to be those intercessors. We have to be those intermediary people to help in those areas with literacy as well. We have to take it. We have to own it. Us. We are the ones at the top. We're the ones at the top. We have to take it, and then we have to teach them to take it and how important it is for them to take it and for them to own.
Thank you, Miss Linda. I think I learned 2 new acronyms, so thank you for that. I will definitely be using that and translate that to my mother, just to help her for a better understanding going forward, but we definitely appreciate your time. We'll go ahead and introduce our next speaker coming up is Heather Lenox. She is a women's health practitioner and the lead healthcare value consultant at Blue Cross Blue Shield of Louisiana. And before working at Blue Cross, she practiced at an OBGYN clinic here in Lafayette. Heather Lenox.
Thank you. They asked me to come today to kind of talk from a clinician perspective on health literacy, and in my almost 20 years of experience in healthcare, I started as a labor and delivery nurse about 6 months after finishing nursing school, because first I worked in med-surg. And I learned very early on in my career that your health assessment of your patient goes far beyond checking the boxes on the piece of paper for your patient. You know, we can all check boxes, but the most important part is to really pay attention to your patient. You have to listen to your patient. It's the things that they say or the things that they don't say, but that their body language says, that really help you to understand how you need to speak to them, how you need to educate them. And you touched on so many of the same things that I wanted to touch on today as well. So it's good to know that we have so many people that feel the same way. You know, and it's not necessarily, as you said, the education level of the person, because we all have different amounts of education in healthcare, different amounts of education in the community, and what, you know, someone knows as an engineer, I would have no idea about. So whenever you have a person that you're taking care of, you really have to take a step back and know what they do and don't understand, and do not assume what they understand just because of their level of education. So I think that that is something I learned very early on, especially as a labor and delivery nurse, because every time that door opens, a different person from a different background, from a different belief system, from a different educational level walks through that door. And when you get them in the room and, you know, they're scared, whether it's first baby, third baby, fifth baby. So everybody has a different understanding, and, you know, you have to start from the very beginning with them and really assess how they appear to be, how scared they are, how comfortable they are, and what's going on in their dynamic, the person around them, you know. And so I think all of that really matters when you're assessing your patients, to get a good understanding of what they need to know and how you need to explain it to them. And fast forward, moving on, I became a women's health nurse practitioner, working in a solo practice with an OBGYN, and then it was having to develop relationships with your patients, because of course at the time I was 27, so walk into a room with a woman having hot flashes and try to explain hormones to her, and all she does is say, "You're too young to understand, dear." And so you really have to, you know, develop that relationship, and by coming down from your educational level and sitting down and talking to them and getting an understanding of how they feel and where they're coming from, you can develop that relationship. And I think that that was the peak of my career, and the best part that I've ever taken away from being a healthcare provider is developing that relationship, because not everybody wants the same treatment. It is not a cookie cutter world in healthcare, as we all know. So I think it's just so important to sit yourself down and listen and observe. That is the biggest part of the health assessment that we can do. So we check boxes all day long, but to me, the box that doesn't exist on the paper is the most important one when we're treating people. And then, fast forward even further, I moved to the dark side. I work for an insurance company, Blue Cross Blue Shield of Louisiana. No, I love it. You know, and I never thought in my career that that's where I would be. But I got to experience something very different. And I took what I love about being a healthcare provider and that education piece and connecting piece to that role, because it was a scary switch in my career. But what I learned was, in the healthcare system, there's health illiteracy. And so there needs to be a better understanding from the front of the office to the back of the office about how to treat patients, and about how to talk to patients, and about how to make that patient experience, you know, seamless from the front to the back. And I worked with a large healthcare system in Lake Charles, and what I learned, they had, I think it was 15 different primary care providers, and they had probably 7 different locations. And what I learned was their core quality department didn't necessarily have the control to train all of their offices to do the same thing, have the same workflow. And so their quality director, she was suffering, and she was like, I need help, I need you to come once a month, I need help, I can't get this going. You know, I've got some providers, and we work in a quality program that they're performing great, and then I've got these that aren't performing so well. And so I was like, okay, so we give out awards once a year, and I said, how about, you have some providers that have awards, how about I come around and I go to their offices alone, not with you, by myself, with cupcakes. And she's like, okay. And I'm like, well, everybody loves a cupcake, right? So I did. I went to a local bakery over there, got some cupcakes, and I went hand out awards, just so that I could see how the front desk treated me. And when I would go in, there were some, literally, would tell me, you can put the cupcake right there, I'll give it to the doctor, you can go. Because they knew that they were going to be found out, I guess you can say, about how they were performing, and they didn't want the doctor to get that information of how their patients were being treated. And so then some doctors, welcome me in with open arms, give me a hug for the cupcake, talk to me, say, sure, come. And so what I would offer every single one of them is, I can help you get your performance scores up. Let's work on your quality. I'm happy to come and spend some time on your afternoon off with your staff, whatever's most convenient for you. About a month, no word, and then all of a sudden her phone started ringing. Can you bring that girl back? Can you bring that girl back? And so she did, and her and I went for 2.5 months to every office on whatever day the doctor wanted. And to my surprise, most of those doctors stayed for the training and the education, and not because I didn't think they wanted to, but they're busy. They got to go make rounds at the hospital, and I always would tell her, your front desk staff can make or break your practice. And this is where we have to start. So if we start there, it will be a trickle effect. And so we retrained all of them. And what I did, instead of saying, y'all aren't doing a good job, instead I said, well, in your waiting room, you've got no educational material for people to read about different healthcare processes. And then, the way that you are answering the phone is of the utmost importance to the patient when they call in. The way that you ask them to sit and wait for a little while, or if we don't tell them, that they're going to have a little bit of a wait because the doctor's a little bit behind, and then they just sit in the chair and they get frustrated. Then when they go in the room, they hear nothing the doctor says, their blood pressure's up, and they're just furious, so they don't hear anything. So telling the front desk staff that they are the first impression that the patient sees and understands, so how it is important for them to understand the program that their provider was participating in with me was, so impressionable on them. So they would say, well, I didn't realize that we were even participating in this. I didn't realize that patient experience and satisfaction was something that played a part in this program. So it was to educate them. They just felt like they were on a time clock, that they were just, not part of that clinical team, but they are. And so I think health literacy starts with us. It starts with us in the clinics, in the hospitals, where we take a step back and say, we might know this, but we got to make sure everybody knows that they are part of making this work. They are part of creating a good quality patient experience. So, and then, looking at the health literacy part of things, because I know I'm kind of talking on literacy between healthcare providers, but I think it matters. I have a clinic, or had a clinic in Opelousas that I was working with for CMS had a program called CPC Plus, and I was one of the care transformation consultants with Blue Cross that worked with them. And they were so innovative, and I was able to go and take what I learned from them, to other practices, and I think it's been very successful, is their office manager took a step back, assessed the area that they were in and the patient educational level, patient type they had, and they are in rural Opelousas. And she called a retired teacher friend of hers and said, I need educational materials, and what I'm finding, my patients aren't going to understand it. So they have different disease processes that they call their patient registries. And she said, can you write me some material at a 6th grade level? And they created their own brochures at a 6th grade level. And this is one of the highest performing practices in our quality program. And that is why, because they met their patients where they were, rather than expecting their patients to meet them where they were. And that makes a big difference, And that's pretty much it in a nutshell for what I wanted to say today as far as health literacy goes. But I think it is just so important for us to not make assumptions about what people know. A little personal story about myself, and thinking about somebody's educational level. For my second child, I had some hemorrhaging, and I worked for my doctor, so, called her in the middle of the night saying, hey, this is going on. So, come in the morning, we'll do an ultrasound, see what's going on. My husband comes with me. My husband sells insurance. He has no idea what the medical field or medical terminology is, no clue. And so he comes in with me, and, ultrasound tech says, you have a partial previa. We didn't go any further because I knew what it was, right? So we leave the room. My husband's eyes are like this. He's just standing there. I go down the hall, talk to the doctor, and she's like, you're going to have to go home on bed rest. And so then I'm like, well, I have 2 patients in rooms. I'm going to go see them first, and then I'll, shut it down and tell my husband, okay, bye. I'll see you at home. Left him like that. Walks out the door, head hanging down, eyes still like this. And then she comes back out the room, and she's like, we didn't talk to Jason. We didn't explain to Jason what's going on. And I'm like, oh, my goodness. So for me, as a healthcare provider, I did just that. I sat there, and just because I knew what was going on, I got my plan of care, go along now, without saying, hey, this is what this means, and so this is what's going to have to happen, and all of that. So, of course, I went home very apologetically and like, all right, let's sit down so I can explain to you what's going on. I'm so very sorry. And that was on me, because I knew she probably thought that I was going to explain it to him, and I just didn't. I knew what was going on. So it's a humbling experience. I've been there before, and I've made those mistakes, but I just think it's so important for us to take a step back and really make sure that we are assessing who we are with and what they need from us. That's it.
Thank you, Heather. Thank you so much. It's really important just to make sure that we're having those conversations, and like you said, meeting people where they are, because regardless of education level, there's always room for improvement. So we definitely have to keep that in mind. So now we'll go ahead and introduce our final speaker for the Health Literacy Foundation's portion, Dr. Ismatara Reena. She is an assistant professor in the kinesiology department at UL-Lafayette. Go Cajuns. She also worked as an adjunct instructor at Lamar University and a medical officer in Bangladesh. Dr. Ismatara Reena.
Good morning, everyone. As you heard, I worked at Health Promotion and Wellness Program at University of Louisiana at Lafayette. Go Cajun, it is homecoming week, so I want to represent my organization. And thank you all so much for coming, and I want to thank the Bacon Community Connection to organize this very time-appropriate summit. And you heard from 2 great practitioner speakers. I am not practitioner, so mine will be a little different than their experience. I kind of focus on my health literacy research, and I had a little experience when I was back home as MD, so I thought that was the problem, the literacy problem or patient does not know is the problem of third world country or developing country, but which is not true. That part is gone from in front of my eyes after I come here. But I didn't do like the practitioner things here, so I moved my career to the academia. So I want to talk about, it's not moving, that's fine. So, so what is health literacy? What do we know about, yeah. So what do we know about it? If you dig down the history, it goes back to 1974 when it's first used, but it was not related to healthcare. It was related to K-12 education, how health information impact the educational system, healthcare system, and mass communication. Then it changed many different ways in the definition and come back to the healthcare settings in 1990s. So over the 3 decades, the practitioner and researchers are working with that word. What does that mean? And I am working too. Still, we need lots of work to do. So in Department of Health and Human Services defined in 2 paradigms now. It was totally individual focus, now it comes to organizational focus. So it has individual health literacy and organizational. Individual health literacy is how a person find, understand, and use the health information for themselves and for others to take a better decision about their health and services. Then organization portion is that how that organization equitably give the opportunity of the individual who are working on that organization. So they do it through the policies, practice, and all kind of system improvement. So as you see my title that my goal is increasing literacy to attain health equity. So health literacy has the 5 different paradigms: self-efficacy, empowerment, self-management, health promotion, and effective use of healthcare system. So any person who has higher health literacy will be able to take care of all those 5 paradigms and eventually better health for them and for the communities. So next is, as I said, that how can we reach the health equity through the health literacy? Again, I am doing the research, and my research group is, my participants is like the higher educational institution students. They have the highest literacy level you can ever think when we do the survey. But when you go to the uses of the health literacy, I don't think they are doing that things. Especially, I can read very well in the reading part and the number part, but honestly, no offense to the header, but I don't understand the language of my health insurance. So most of the student has health insurance, but they don't know that they have a yearly free health exam. That will not charge them anything, not a single penny. But they don't know that. They will not go to do that things. They will go to doctor when they have a problem. They will not go to find the problem, identify the problem ahead that they don't have to suffer. Or even they don't have any problem, but they will know as soon as it is there if they do that yearly checkup every day. That is not one, that is for all students. If you consider international student, I came in this country as an international student. I know how that things works. So still, I came here in 22 years ago. Who is coming now? They're doing exact same thing with their health insurance. I did that. So as an advocate, as an educator, I think we have to make the change and give them the education that how to use that health literacy they have to have the better health and services for themselves and for others. So again, research, what I am doing found that they have higher literacy, but when I ask them about practical application, which is not, we are not that far yet. So we have to work hard as an advocate, as an educator, and I have some colleagues and friends, hopefully we will be working together to move forward. If you want to know about national data about health literacy, you will be surprised that the only nationally accessible health literacy data is back to 2003. We don't have anything after that. I know this is a small community, we cannot go that far further, but if you start working one steps at a time, eventually we may get a national data which represent better what is the status of health literacy now. In 2003, data showing that 36% of the total US population has a basic or below basic health literacy level, and only 12% is fluent. So which is very alarming, and low health literacy cost us a lot in healthcare. Research has shown that if we spend $25 in health literacy, $1 in health literacy, we can save $25 in healthcare cost. So that is 25% higher. So hopefully I will request you all, we are all in healthcare settings now. We'll be doing our part to advocate and make them literate and save them. Thank you.
Thank you, Dr. Ismatara. As a UL grad myself, I didn't know that some of those resources were available until later on. And like you said, people go when they have a problem instead of just going just for a regular checkup. So it's really important just to make sure that, you're just checking in and making sure that everything's good to go and that you're okay. So we can go ahead and move into our discussion. We got the individual side, we got the clinical side, and then the research that helps back up Health Literacy Foundation. So whoever would like to answer first, as you've all worked in the medical profession, what is the biggest challenge when talking to some of these patients?
I would say the biggest challenge is getting them to want to, in the community, is getting them to want to take care of themselves. I think in the community, a lot of our people here rather not know, like you said, not go for a regular checkup, but go when there's a problem instead of taking care of themselves prior. But you don't know won't hurt you. And we know that now with so many comorbidities from the disease process and the diseases that are prevalent in our community, as a community worker, I want you to know that could be a couple of things you can change in your life that could keep you from that disease, slowing that disease process or canceling it out all the way. I have family members, they're all diabetic. We were 7 siblings and I was the only one who wasn't diabetic. But the siblings know the weight because we were all overweight. They know the weight, losing the weight. So several of them have gotten off of all their diabetes medicine because they lost weight. And those are just like simple things in health literacy to know. So in the community, it's getting people not to be afraid of knowing what's going on with them so that they could be empowered and learn and do those things to slow that disease process in our community.
I think the hardest thing is to teach someone that they can be their own advocate. So along those same lines, empowering them to start to want to take care of themselves or to take a hold of their health. In women's health, I had this personal experience with this young girl where, she would come in and unfortunately, having unprotected intercourse and getting diagnosed with something, and it was a recurring thing. And her mom and I are still friends today after all of that. But every time I would talk to her, there was this blank stare. You couldn't tell if you were getting into her. You always got the yes, ma'am, and I understand, and repeat, what I've taught you and whatever. Until one day I said, it's okay to say no. And she just looked at me. And I was like, I'm going to explain something to you. And I said, you're the only person responsible for yourself. So it is okay to say no. Be responsible for your health because in the long run, the only person this is impacting is you. And it's like the light bulb went off. And after that, she was good. And I think it's telling them that it is okay to speak up for themselves because a lot of times they don't realize that young, old, it doesn't matter the educational level, they don't understand how to speak up for themselves. And I go through this with my parents all the time, going to the doctor. They call me afterwards with, what the doctor said and what they didn't understand. I'm like, then why didn't you ask the question? And they're educated people. but why not ask the question? You know, they're going to explain it to you, but if you don't say anything, they think you understood. So just getting them to, you know, become advocates for themselves, and I think that is a huge lesson that we could teach people, is to be advocates for their own health, no matter, you know, in how that goes about and in what disease process it is.
I'm echoing with both of them. Like, it could be literate, but breaking the barrier between the provider and the receiver is really important, and understand their level and assure them that you can ask anything to me. Then, like, teach back methods could be important, and I think that's the hardest barrier I found in my research group. Thank you.
Part is really just understanding, and sometimes that can be a barrier for some people, and that actually leads into my next question for these patients who, you know, maybe feel intimidated going to the doctor or you know, speaking up about what's going on with them internally. How can they be better prepared when they're going to the doctor?
Okay, so I have a little scenario. You know, I have a story. So I have my best friend, sister, young woman, had a stroke several years ago. Well, recently she had a major blockage. So she's in a vegetative state right now. And I went to visit at the hospital, and she had a rash in her face, and her bowels had moved, and it was several things. They wanted the prognosis. Well, I was in there when the doctor came, and some of the other family was there. I said, would y'all like me to step out? And they were like, no, I want you to stay. So the doctor started explaining, rattling off, ba, 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 ba. But after that, he said, do you have any questions or concerns? She was blank. I know I had some things, but I don't remember. And I rattled them off with the things she wanted. Write them down. Write everything. I tell my patients, write down what's going on with you at home. That way, when you go to the doctor's office, you will be able to tell them, because you're going to, I forget. Oh, I forgot I wanted to ask him about this or tell him. Write it down. It's simple. Write things down that you need to ask your doctor.
1000% agree. Write it down. I've always told patients, bring me a list. You notice something? Write it down. That way, when you come back, you haven't forgotten a thing, and we can talk about it. I think they don't want to bring a list because they think that they'll be looked down upon for bringing a list, but bring the list. That's the only way we can know what's going on, you know? And so I think that 1000% agree.
I'm with them too. So write it down, bring it with you. If you think that you don't want to do that, then bring a family member, share with that person everything. So when you are in doctor's office, you have a disease, you will shut down. You will, with the fear, with the stress, on all those things, go and talking with healthcare provider. So bringing family member can help too.
I actually want to go back to what Ms. Linda said. We've all used Dr. Google. We've all used the internet and social media to get information, and sometimes it's misinformation. Yes. And some people may be using that as a viable source to, you know, have information before they go to the doctor and talk with them. So how can they, you know, not engage in that misinformation or avoid it so they can have a better healthcare experience?
That's a tricky one, working in the community. You can't empower the people if they don't know. People need information. I use the church faith base a lot to get information out into the community. Let them know what's available for them to use. They're amazing navigators now with insurance, because a lot of people don't know what Medicaid covers or don't cover. And they don't know there are navigators that are available in our community that can help navigate the system for them. So during COVID, for example, we did a lot of Zoom calls. So we were my thing was who's Zooming who? Remember the song, Who's Zooming Who? And the people on the Zoom were actually just us, just the people that were, had the programs. So we were Zooming each other. The community wasn't involved. So how do you get the information in their hands? How do you tell them where they can go? How do you get them from sitting in a clinic all day long because of the wait and so many people when there's a clinic across the street or across town that not far that takes the same patients? Or there are some physicians in town that strategically and specifically work for the Medicaid population. But if you don't know, you don't go. So that's a tricky part. It's getting the information in their hands so that they can be empowered.
Yeah. I think I appreciate the fact that people want to use Dr. Google and look up things. And, we would come across that a lot in practice where, they would basically come in telling us what lab tests they needed to check for a certain type of cancer. And I was like, I appreciate Dr. Oz, love him too, but, let's talk about this. And so, but being prepared to explain to them what they read or what they saw or heard is more important. So it's okay for them to be curious. It's okay for them to want to engage in their health because that's a good sign. They want to engage in their health, but then being prepared to have the right answers for them. So to say, oh, you shouldn't have gone and look it up. Everybody's going to look it up. So you can't even expect them not to. But to be prepared with explaining, well, this is what this test will really tell you, or this is how this is really found. This is what you really need to do. And I think that helps. And it's all about instilling trust. It's all about instilling trust. And so then they back down from that conversation and say, okay, I understand. I probably don't need that test today, but I'll let you know if I'm feeling something.
Yeah, I just want to add one thing. Like my daughter is very small. If I can find anything, she said, Mommy, don't you know you can ask Google? Google knows everything. So I tell my student, yes, I know Google knows everything, but there is some reliable source you can use, not everything, which is usually end with GOV website. So if you want to find anything from the internet, that is the source, or you have to go to healthcare provider or clinics, so who can give you the reliable information.
And with health literacy foundations, it's kind of like a two-way street. The patient has to understand what's going on as well as the healthcare provider. So can you guys talk about how important it is to, build that relationship with them so they can feel more comfortable going to the doctor, talking about what's going on, and making sure that all their bases are covered as well?
As working in the community, that's important. You have to gain their trust. And honestly, I love people, so I build relationships working in the faith-based initiative. And I've made a lot of relationships with other organizations so that you know who to call, you know where to send them, you know what they need. And if you don't know what they need, then you try to help them and get so that they can understand and find and get what they need to take care of whatever's going on with them. We have to be connected because I can't help everything, but that's what I do. I try to connect them with what they need if I can't personally, or the hospital can't personally meet their needs.
That's right. Yeah, and instilling trust with your patients is key. And I just said that a couple minutes ago, but also, like you just said, creating a network of providers that you can reach out to for the needs of your patients, because we can't treat it all. But if they trust you and you tell them, I trust this provider, so I think you should go and do this, they'll tend to listen and they'll own it. And, I had this one little lady one year, and I can't remember how old she was, but I finally convinced her to go get a colonoscopy. It was like, hallelujah. But she went, and so, I get her report back, and then she's coming in for her visit, and I'm like, you went and got a colonoscopy? She said, I sure did. I walked in there, I went to the guy you told me. I'm like, mm-hmm. And she goes, and I told him, I need a colonoscopy because that little girl over there will not leave me alone. And so he's like, okay. And I'm like, so then, you know, I messaged him and I was like, thank you so much for seeing my picture. He was like, all right, little girl.
Little girl.
So, I mean, you know, they trust you, and then they'll kind of do what you tell them to do for the most part. You know, I think that's very important.
Yeah, it's gaining connection and develop that trust is important.
Well, give them a hand. Thank you all very much. We definitely appreciate your time. That's just one of our 2 panels that will be happening today. So, ladies, thank you again. We definitely appreciate